Hi guys, how are you all doing? You're welcome to my channel. This is Vera. So today I want to tell you people how I absconded from chemotherapy. Yes, you heard me right. I ran away from chemotherapy. But before I continue, I would like to welcome my subscribers. You're welcome. I would like to appreciate you for always visiting my channel and watching my videos. Then I also want to appreciate my friends who are just joining me for today, as in they are seeing me for the first time today. They're just seeing my face. You're welcome. I thank you. I'm very grateful for your visit. And I'm telling you or urging you, please subscribe, hit the notification button, give me a thumbs up. That way, when you do this, you are supporting me. So today, like I said, I want to talk about how I absconded from chemotherapy. It happened that about 8 years ago, I was having breast cancer. I'll be going for from one hospital to the other because I something was happening to me. They referred me to the department where they take care of that. In the same hospital, after a series of tests, they referred me to I think oncology department or something, but it's called SOP. I think SOP 2 also. SOP something, either one or two, surgical operation department, something like that. So I was going there. When I got there, I saw some of my friends, as in, so I saw some people like me that were having such challenges. There were cancer patients of different types. All of us were there. So I was going there. So as we were there, I was relating with some people. We made friends. We were gisting. So that they asked me to go and repeat those tests. Those ones I did the other place, they didn't take them. They said it's whether it's outdated, they need to know what is happening now. So they asked me to do some tests again, like biopsy, mammogram, scan. So I was going for all these tests. So the period I was going for tests and the period I was coming for my appointments, I observed something. I noticed something. So during that time, some people were already on chemotherapy. Some people were already on treatment. Those people that were already on treatment were those that were even buoyant to do this treatment, or those that have really stayed long, they were due for the treatment. So, but I noticed that these people that were on treatment, if you ask me, the treatment was not doing them well. I noticed that even those of them too that had not really started coming so early. There were some people that I started going there before, but they started doing this chemotherapy because of the before me. They started doing their treatment before me, maybe because of they were having money, they were rich, or due to one reason or the other, maybe their cases were more serious than I or what I don't know. But due to some reason, I will see them, they'll be fine. And before you know, they've started chemotherapy. And once they start chemotherapy, boom, they are down. You will think the person has been a cancer patient for years. Most of them will enter the hospital with their leg, they will have appetite, they'll be living normally just because they've realized that something is wrong with them and they went for this treatment. Before you know, it will be as if it's now that the cancer is now ready to kill them. Before I continue, I would like to define chemotherapy. I've written it here. Chemotherapy is a drug treatment that uses powerful chemicals. Did you hear that? Chemotherapy is a drug treatment that uses powerful chemicals to kill fast growing cells in your body or in a patient's body or in a cancer patient's body. You know, it uses powerful chemicals. Let that word sink into your ear. Powerful chemicals. They are injecting chemicals into people's body to kill growing cancer cells. To kill cancer cells. That is what chemotherapy is. So this chemotherapy has very, very strong, scary, terrifying side effects on the people that they inject it to. So I noticed people going through this chemotherapy, and I noticed all this some negative effects on these people, like pulling of hair, which is to me is not even a very serious effect. If your hair pulls and even if it doesn't come back, you can wear wig all through your life. That's not even a serious one. Um, Another effect of chemotherapy is coloring of the nails, making the nails to be black. Another one is weakness. Another one is vomiting. Another one is stooling. Another one is not having appetite. Another one is listening or hearing strange music that today and some of them will feel like dancing. Another one is hearing voices that someone is calling them. You know, someone will be talking to them, they don't know the person, they'll be hearing voices. Some strange, strange things will be happening to them. Some will be stooling blood, some will be vomiting blood. Can you imagine when someone is vomiting blood? Or when someone is stealing blood and the person said might not be eating well. I can imagine when someone is vomiting and the person does not have appetite and the person is vomiting constantly and no appetite. That's a very, very dangerous sign. Or when one is losing blood, or when one is trying to answer someone that is calling him or her that he or she is not seeing. Is that not madness? Or when one is trying to dance to a music that he or she is listening to or hearing, but in the real sense of it, there is no music anywhere. It's only the person that knows where the music is coming from. Is that not partial madness? Hmm. Those were the things I noticed that were happening to people that were taking chemotherapy. Weakness, they'll be weak, you know. That reminds me of one of our family friends. In fact, two people that I know that went through chemotherapy. They're all dead now anyway. This woman, the first woman, her own is that she has this character of going to do, what's it called? Going to do tests, mammogram every year to check herself, which doctors advise us to be doing, that we should go and be checking ourselves every year. That is, if you can detect this lump early enough, early detection is the key. If you can detect it early, that's the best. Of course, she detected hers early and she went to them. They told her to do that biopsy, which they did. They find out that it was malignant. So they removed the lump. After removing the lump, they would now do chemotherapy. They will now treat the person with chemotherapy. So they removed the lump. They said treating her with chemotherapy. Of course, when I saw her, I was so scared. I know this woman now. Is this how the cancer? Then I did not know it was the effect of chemotherapy because then it had not happened to me. So I was like, hey, this is how this cancer has dealt with this woman. And I'm so sure that those are not informed about this. When their people start taking chemotherapy and the effects of chemotherapy is on them, they will feel it's the cancer. I'm telling you, it's not the cancer. It's the chemotherapy that has made your loved one to be so dark, to be slim, not to eat. It's not cancer. Don't say it's the cancer that the person is reacting to. That it's cancer is making the person not to eat. She has cancer. Because that's what people say. When it happens, they will say, she has cancer. If somebody say the person, Mr. John, why are you like this? It's cancer. Oh. It's not the cancer. Remember that before that, your loved one went to start taking that treatment, the person had appetite. The person had his or her normal body. But once they start, so when this my family friend started, all the effects of the chemotherapy, the brown nails, the black, her whole body, if you see her, she was looking so dark, like even a dead person, like somebody that was almost burnt. She was not looking so small. Her voice changed. She couldn't talk well. No appetite. In fact, but when she regained herself, she told me that she come and thank her husband for treating her. She even told me that her husband friend told her husband that how can you be spending millions for her, that if he's the one, he will not spend it, because they spend a lot of money doing this treatment. So I thanked the husband. She said, no, Avera, how can you stand up? Please kneel down. My husband saved my life. He spent a lot. I knelt down and I thanked the man. And after roughly a year, the thing came back. And when he came back, she went to do the normal treatment again, which was chemotherapy. And of course, she died from there. She wasn't lucky to have survived the first one. Some people, they don't even survive it. So chemotherapy is, the effects of chemotherapy is so strong. So I saw all this. I was so scared. And why is chemotherapy like this? It's like this because it's killing cancer cells. And the unfortunate thing is that it does not know the difference between cancer cells and normal cells. As it is killing cancer cells, it will be killing normal cells. It will attack normal cells. And even important organs, it will attack them, like your liver, your kidney, your heart, all those important organs. It will attack them, and then that's why some people die. Most cancer patients die through chemotherapy and not even through cancer. They died through chemotherapy treatment. So when I observed all this, I was so scared. Not only me, most of us there, we noticed it that chemotherapy kills, but all of us, we concluded that it was the cancer. Most of us believed that it was cancer, but I knew that it was not cancer because I knew that some of us will use our leg and enter there, go and take chemotherapy. After taking chemotherapy, to go home becomes a problem. If you manage and go home, the effects of the chemotherapy will hold the person. And for your information, most chemotherapy is not usually done once. Some people take up to 8 times, 9 times, 10, even up to 12 times, 8 doses, 6 doses like that. And the more you take first one, before you finish recovering from that one, they will give you another one. And that's how it should be, leading the person to the grave. So when I noticed all these things, I was so scared. But I had no other choice but to do it. So when it was time for me to do my surgery, I did my surgery. And normally after surgery, they always ask the person to go home so that when the surgery injury or surgery wound or whatever you call it has healed, the person will come back for chemotherapy. So when they did my surgery, I went home. But that reminds me, before I went home, before I did my surgery, like I told you, most of us, we know the effects of chemotherapy. We know that cancer is dead, but all of us then we're seeing it as cancer. Cancer is deadly. Cancer is this. Few people, or I don't know, but as for me, I knew that it's not only the cancer that was killing people there. I knew it was that thing. So because of the what we have seen, we are scared. Some of us were already preparing for our burial, even when we are alive. Can imagine when somebody is alive and you are you are preparing how they will bury you. One woman told me that she has already told her husband the kind of dress to wear her when she dies. And that she has already told him the kind of picture that he's going to use for her obituary when she dies. She was already preparing because she saw people dying. So she believed too that her own will not be different. Even me too, I was scared when I got home too. After some time, when I finished doing my surgery, I told my daughter I'll soon be going for my chemotherapy, and I was telling her how she will be able to live without me. I was grooming her, telling her, trying to make her live a motherless life, trying to make her. I was even happy that I had the opportunity of telling her that I didn't take her unaware. I was telling her in case my enemy dies. Well, so I will continue next time. But before I go, please don't forget to subscribe. Don't forget to give me a thumbs up, give me a like, hit the notification button, comment. No man is an island of knowledge. I don't know it all. If there is something that I've said that is contrary to your own belief, you can tell me. If you agree with me too, you can tell me. Just comment, and let's move. Thank you very much until I come your way next time. Bye.